Most doctors miss this bowel finding on ultrasound, and that single miss can completely change a patient's outcome. What you are seeing on the screen may look like overlapping bowel loops at first glance, but if you dismiss it as gas or peristalsis, you have already made the first mistake. On transverse imaging, there is a well-defined concentric multi-layered appearance creating the classic target sign, and this appearance should immediately stop you from calling it a normal bowel loop. When the probe is aligned longitudinally, the bowel suddenly transforms into a pseudo-kidney or sandwich-like structure, and this is the moment where the diagnosis becomes obvious. Inside the intussuscepted bowel, echogenic mesenteric fat and soft tissue are clearly seen dragged into the lumen, and this single finding confirms that this is not transient telescoping, this is a true, established colonic intussusception. Remember this clearly, normal bowel loops do not pull mesenteric fat inside them, but intussusception always does. This is exactly where most people get it wrong. In children, intussusception can be idiopathic and sometimes self-limiting, but in adults, especially when the colon is involved, intussusception is never innocent. Adult colonic intussusception almost always hides a pathological lead point, often a tumor, polyp, or malignancy, and missing this diagnosis can delay life-saving surgery. Even if bowel wall layers appear preserved today, and even if there is no free fluid at this moment, this is still a ticking clock scenario. Here is the golden rule of bowel ultrasound that every radiologist must remember. A target sign with internal mesenteric fat in an adult colon is surgical until proven otherwise. At this point, reassurance is not management. Follow-up alone is not enough, and the correct next step is urgent CT correlation and surgical consultation. Lock this concept into your memory forever. If it looks like bowel and behaves like bowel, it may still not be normal, but if it shows bowel within bowel with mesenteric fat inside, it is intussusception. Ultrasound is not just about scanning structures, it is about recognizing danger early.